All right, I want to welcome everyone to Mvskoke Media's Live Wire. I'm Angel Ellis, reporter for Mvskoke Media, and I am joined this afternoon with two really great guests. We have some wonderful topics for everyone to hear about on this fine Monday. I'm going to introduce Dr. Beets, who is the Chief Medical Officer for the Mvskoke Creek Nation Department of Health, and Dr. Vark, who is the Deputy Chief Medical Officer for Mvskoke Creek Nation Department of Health, and we're going to be talking about coronavirus vaccines today. And so kind of give us whoever wants to go first, you can give us the scoop on what the latest news on the vaccines are. We're hearing people talking about it, and the headlines have been well engrossed with coronavirus vaccines. So where are we at with the nation? I know that recently, several weeks back, I think the Department of Health conducted some surveys and things to kind of figure out logistics and things like that. So can you kind of fill us in?
Yes, Angel, thank you so much for allowing us this opportunity to speak to our citizens and our patients and the community in general. We appreciate your time. We know you have other stories as well. And thank you for inviting us to speak about this important topic. As everyone knows, this year has been a long, difficult year for our nation in general and for our tribe, of course, with the COVID-19 pandemic. It's made a significant impact on our tribal society, our communities, our homes, and our families, with people becoming ill as well as loss of loved ones and friends. And so it's been a difficult year on many fronts for pretty much everybody. And so it's always nice to have kind of a light at the end of the tunnel, so to speak. And although we have a long ways ahead of us, at least we now have some hope in this vaccine that is shortly becoming available. Currently, there are two vaccines that are basically going up for what's called an EUA, Emergency Use Authorization. The first one is actually developed by Pfizer and BioNTech, which is a German pharmaceutical company. They developed this jointly, and it actually goes up for its EUA this Thursday on the 10th. The second vaccine that everyone's probably heard or read about in the news media is a vaccine from Moderna, and it actually goes for its EUA on the 17th. So there's two definitive vaccines currently. There's multiple other vaccines that are currently in the pipeline, having to go through the different phases of trials, but these are the two that cross the finish line, so to speak, first. The Pfizer vaccine is the vaccine that we will be receiving at the tribe. The Pfizer vaccine is basically a new technology, so to speak, that is the first time it's been used in a vaccine. And so we're excited about possibly receiving that. We hope maybe next week. It changes day to day because of distribution lines, et cetera, and the requirements for transportation. So we're hoping to possibly receive that vaccine next week.
Is there any kind of process in place right now to determine how that vaccine is going to be implemented and distributed? Have you guys, is there stage one would be can you kind of walk us through that part of it?
I'll hand that off to Dr. Vark. He's more active in our vaccine task force on a day-to-day basis, so I'll let him answer that question.
Okay.
Thank you very much for having us on. We basically now are following the guidelines that have been set by the CDC with regard to distribution. It's based on a tier system. There's a 4-tier system. Tier 1 is generally dedicated to healthcare workers and those that are residing in long-term care facilities like nursing homes. We feel like those vaccinations will be fairly rapid in terms of getting them out and getting them completed. Tier 2 has much more to do with the general public, and it is those individuals that are age 65 and older and those with pre-existing medical conditions. Tiers 3 and 4 have to do with individuals, for example, in the Department of Corrections, some individuals that live very remotely and those, individuals might have a little more difficulty getting in to get vaccinated. And then the general public at large that are, young, have good health profiles and aren't at high risk for bad outcomes from COVID-19.
Okay, so it seems like they kind of have like this kind of like priority system that you would kind of typically expect with like the most, well, first of all, healthcare workers who are trying to keep us all healthy are kind of having a really hard time and getting them vaccinated so that they don't succumb to the different, things that are out there, and they can keep going, keep the hospitals going. And then you start looking at patients who might have the most critical kind of outcomes for elderly, those who would be more vulnerable. And those are, you said those were CDC kind of guidelines on how to implement. Is there any word yet on how the relationship to distribute is going to be? I think in the news we've seen some word, maybe indication that like it would go through state health departments, but how does that relate to IHS facilities and the Mvskoke Creek Nation specifically? Would it be direct from federal sources or what?
When vaccine distribution was first discussed, individual facilities and organizations had the choice to either utilize the state for vaccine receipt and distribution or going through IHS. The Mvskoke Creek Nation elected to go through IHS for our vaccine distribution and receipt. So we will be getting our vaccine from the Indian Health Service.
Will that affect the timeline any differently than say waiting for the state, or will it be more expeditious this way versus another, or is it about the same? Do you know?
As far as we know, there won't be any difference in the timeline at all. If anything, I think IHS may be given a little bit of priority because the statistics have shown that Native American populations are 4 to 6 times more likely to have a severe outcome from COVID-19 than their matched counterparts in the Caucasian cohort. So I think IHS is going to be very expeditious on getting their vaccine to us.
Awesome. That's good news to hear. I know our Native American populations do tend to get hit really hard. And then considering, location wise, we're fortunate with the Mvskoke Creek Nation being, in, a pretty urban area, but then parts of it are not. And we do kind of span out into rural areas, and many Native American tribes do. Dr. Beets, can you give us any kind of, just kind of overall, I guess, the overall health kind of update on this vaccine and how it's going to be thought to be impacting the numbers, and just how we've kind of all been managing our lives here lately? Well, some folks are like, is this like the flu vaccines? Are they good matches? Things like that. Can you kind of educate us there?
Well, the Pfizer vaccine is a vaccine that is an mRNA vaccine. And what that stands for is it's a mitochondrial vaccine that, in essence, directs the cells of the body. It gives instructions like a blueprint to the cells of the body to start developing a protein that then can develop an antibody response for us. It does not have any COVID-19 in the vaccine whatsoever. So when you receive the vaccine, they're not, like some people in the general public are concerned about, well, are they injecting COVID in the vaccine? And they're not. It is basically given some instructions for your body to prepare in case, COVID, you should encounter COVID-19. It entails 2 injections. The first injection, after you receive it, you will have your second injection anywhere between 18 and 23 days later. It's pretty specific. With the Moderna vaccine, you actually receive your second injection 28 days later. And that's extremely important, the timeline, because if you don't hit the timeline correctly, then you're not going to get the full effectiveness of the vaccine. It's estimated about 7 to 10 days after the second injection, then you have your immunity. The Pfizer vaccine is about 95% effective, which is actually pretty substantial in comparison to most vaccines that are out there right now for other things like MMR, et cetera, that people routinely take. So that's kind of the timeline. One of the big challenges, of course, that all health systems are going to have is the sheer volume of people that need to be immunized. And so we've had to make some projections on that in regards to the number that we think will want to receive the vaccine. Those numbers nationally, as well as within the tribe, on our initial polls, range anywhere between 40 to 47% are saying that they will take the vaccine. Some individuals are saying they're not going to take the vaccine initially. They're going to have, friends who may want to take it or something. They're going to say they get it, and then they're going to watch them to see how they respond to the vaccine.
Okay. Is there any concern? I know that in the past, there are some vaccines that you routinely over time get again, but with this one being a two-part, kind of vaccination, is there any concern with that might, hurt the effectiveness? Because sometimes people aren't great about getting right back, into the appointments on time. Is that something that we're worried about?
It is, when the patients receive their vaccination, their first injection, they'll be given a card and an appointment reminder, basically, and then also have an appointment scheduled within the system. And they'll be told a specific time if they need to return to receive the second vaccination or the second injection. The first injection, when you receive it, you will be presumptively given a modicum of some type of effectiveness or immunity, but you're not going to get the full effect that you could from the vaccine if you don't receive the second injection. So it's extremely important that you get both injections.
Kind of like that old thing that we're all used to. If you have to have the medicine, be sure and take it all kind of scenario, it sounds like.
True.
Yes. Is there any timeline? I know that, we're still a little bit in gray area on when we would receive the vaccine for tier 1. Has there been any definitive kind of timeline for the times we'll start seeing citizens becoming vaccinated and that availability for them?
We have, the vaccine will be in very limited supply with the first distribution. We're probably talking low thousands of doses. However, all the indications from the government that we have received, which are subject to change, I think it's very important during this talk to let our listeners know that, this is still it may be the final stages, but it's still in a planning stage, so things are subject to change. But the government is very hopeful that in January, February, and March, they will be releasing vaccines in the tens of millions. So we are very confident that we're going to have vaccine available for many, many more people in relatively short order. So I would say that vaccines for other than healthcare workers, we are highly hoping, highly anticipating that will occur in January sometime.
Okay, good. Once we start seeing general populations receiving this vaccine, how long do you think that it could be in measurable terms that we start seeing improvement of these outcomes? I know that our communities have been pretty hard hit, and we've, it's been a really difficult time for families, and, lots of people become ill. When people start actually getting this vaccine, is there any kind of timeline to see when it can alleviate that burden on the health system and on people's kind of everyday lives and, with the fears and things and precautions that they're taking?
Well, that's a question that, unfortunately, it's a question we all ask: when is life going to return to normal, so to speak? And unfortunately, I don't think that that's something that we can truly answer. It's going to be dependent on a number of factors. We're inevitably going to have to continue the social distancing and wearing the masks and washing the hands and not being able to travel and go to large sporting events, etc., probably until the end of the summer or the fall of next year. And part of that is going to be because of the timeline of people receiving vaccines and when they're available, and you have to hit a certain mark in order for us to basically develop kind of a generalized immunity in society. I don't know that, there's so many variables in that that, if we have 40% of the population say yes, they're going to take the vaccine, but then you have 60% of the population saying no, then it's going to be a little bit more of a challenge for us to get to that point. But I think we will eventually. I don't know if Dr. Vark has any more information on that from any sources in regards to what a projected time would be.
Well, Dr. Beets, I think you're quite accurate. I can tell you that I was involved in a discussion this morning, and one of the speakers was the director of the National Institutes of Health, and he refused to be held to this, but he did say that he was cautiously optimistic that he could see a baseball game this summer if everything went according to plan. A lot of that, though, as Dr. Beets has said, is dependent upon the willingness of the public to get involved and participate in the vaccine program. A vaccine is like antibiotics. They're wonderful things, but just like antibiotics don't work if they're still in the bottle, the vaccines don't work if they're not administered to people. So we're really hoping that participation is going to increase with people seeing that, there are safety steps. No safety steps were compromised in the making of these vaccines. Every step that has been taken previously in previous years from vaccination has been taken for these. It's just that we have improved technology now that allows some of the in-between times to shorten. So the vaccine, they have been extremely judicious. There are at least 3 different independent bodies that review all the data from these vaccine studies to determine that the information is correct and that the safety and effectiveness data are correct.
So, I know in the past, we've kind of heard, the need for it being urgent and everything. You're basically saying that every bit of testing and all the different trials that they go through, none of that has been compromised just because of the priority of need. It's still been a very intensive and well-documented process. Do you guys have any insights into what goes into that? I'm not even sure what that looks like in the labs. I'm not a scientist and definitely not a doctor, but I often hear something about the trials and different things like that. Can you kind of give us any info on that?
Well, when you have there's 3 primary steps involved in the development of a vaccine, and it can vary depending also on the pharmaceutical company. They may put in additional steps, but basically you would get a group of individuals, and let's say you had 100 individuals or 200 individuals, and you would take 100 of those individuals and you would inject into their arm normal saline. Okay, so it's basically water. The other 100 individuals, you would inject the vaccine that's in the studies. And then you basically send them into the population, they're living their regular lives, and you see just exactly how many come back and test positive in the placebo group, so to speak, that receives a normal saline injection, and in the vaccine group. And then you can kind of determine what the effectiveness is. It needs to be at least 50% effective for it to be considered a success, so to speak, so 1 in 2 chance. Like I said, the Pfizer vaccine, I think, is at 94.5% effectiveness, and I believe the Moderna is at 95% effectiveness. So that in essence would tell you that there was only 5 individuals that contracted signs and symptoms, so to speak, of an active COVID infection out of that group that received the vaccine. So they go through the different phases, and then they look for any type of adverse reactions. As you probably have read in the media and heard, there was one of the vaccines, they actually stopped it because there was an adverse effect for one patient, and they had, like Dr. Vark said, the 3 different independent groups review that data to determine if that truly was something that was caused by the vaccine or not, and it was found that it wasn't, so they continued with the trials. After they went through all these trials, then they have to be approved by various government bodies and, by the immunization panel, and then they have to make their decision if it's something that can be used.
Awesome. I think that one of our viewers has got a question. I think that you might have answered this, but it probably is worth repeating. She's asking whether or not this vaccine has the live virus, and earlier you stated that it does not. Can you kind of just recap that briefly for our...
It does not. You know, when, for example, you know, if you take the flu, when you take the flu vaccination, you know, in the past they could use with younger people the live virus by squirting it up people's nose. They don't really do that any longer. Now it's primarily the shot for everybody, and it's like an attenuated virus, which means it's weakened. It's not full effect or full bore, so to speak. They can cause an infection, but it makes your body have a response, in essence. This vaccine, the Pfizer vaccine, does not have live virus in it of COVID, dead virus of COVID, weakened virus. It has no COVID whatsoever in it. It is explicitly, basically instructions to inform your body, you need to start making this protein so you can start making antibodies in case you are exposed to COVID-19. So basically it's your body is developing a reaction to an infection that's not even happening. So it's ready to go in case COVID-19 should manage to get into your body.
So kind of a trick infection, so to speak. Okay. Anybody else have questions? I'm thinking that looks like we're kind of petering out. It is a Monday after all, and usually by the evenings is when people really start watching these kind of broadcasts. But just to kind of recap, you guys are preparing for distribution on first tier kind of vaccination. That's going to include medical staff. And then the next kind of phase of that is based on CDC guidelines. And can we just kind of have, was Dr. Vark, you kind of outlined that for us real quick, and maybe about the timeline when we start seeing general citizens vaccinated?
Yes, the tier 1 vaccines go to the healthcare providers and to residents of long-term care facilities. Over 40% of the deaths that have been recorded due to COVID-19 in America, sadly, have been from residents of long-term care facilities. So they are at extremely high risk. After that, we start getting into, and there will also be what they call, I don't want to get too far off in the weeds here, but there's a tier 1A, which will also be, for example, law enforcement, first responders, individuals that are necessary to basically, you know, keep society in a functioning state. They will also be a high priority. After that, we're talking about individuals that are over 65 and individuals that have medical conditions that put them at higher risk, such as diabetes, heart disease, lung disease, and kidney disease those are probably the 4 that we are concentrating on the most. There has been some evidence that folks that are significantly overweight may be at a little bit higher risk, and that is also considered a risk factor. So if you have any questions about that, please don't hesitate to contact any one of our clinics. We can certainly let you know, you know, what your risk panel looks like and when you would be eligible for the vaccine. We are working night and day on this plan, and we're kind of doing it on the, I don't know what the term is, but on the supposition that things are going to go a certain way. And so we are doing everything that we can to ensure that we get this vaccine out to everybody just as quickly as possible. And just to add something to what Dr. Beets was talking about, when they do the trials in the vaccine, the third trial of these vaccines involves a minimum of 30,000 patients. So we're dealing with a very large number of people in that final trial. So they are truly getting a large section of the population in an attempt to see, you know, the larger the section of population, the more likely you are to pick up an adverse event. So they do start out small, but they wind up getting very large in order to try to ensure safety of vaccines.
Okay. Has there been any like reports on the demographics of those testing groups? Do we know like if any of it, if a portion of them are representative of Native American populations, and that is, or is that kind of too early to tell?
My understanding from Pfizer is that they do have a reasonable cross-section of individuals of color that are represented in their studies. The two groups that really aren't represented right now are children and pregnant ladies. Obviously, those are groups that are a bit more. We have to be very careful about studying them. Obviously, unfortunately, children aren't just small versions of adults, and they can have some different reactions to vaccines. And obviously, with pregnant ladies, we're talking about an unborn child as well as the lady herself. So they're much more cautious, and they'll probably wait for more safety data to come in before they start. They've just started on the children, and they're working from the age 12 and up, I think, right now. So those studies are forthcoming, but those are usually the last groups that get tested in these types of trials.
Okay, wonderful. Well, I think that that's all the questions we have. If you guys have anything to add that I've forgotten, you want to leave anybody with any bit of advice, I know for now, probably wear your mask and wash your hands and continue to keep your distance until early next year when they start distributing to the individuals who are first priority. Make your appointments and get your vaccines. Anything else, guys?
Well, I think those points are very, very good points to continue to make. That right now is our best defense against further spread of COVID. I can just tell you from a personal perspective that when the vaccine becomes available, as far as I know, all of our administrative staff and all the doctors that I have talked to are confident in the safety of the vaccine, and they do plan to receive it. So,
Good.
Dr. Beets?
And I would also say that for the citizens and the patients and the communities, there will be information coming out with public service announcements. Don't know how many of those there will be. They will probably be sporadic as this continues to roll out. And we're also developing plans internally as far as how to contact citizens and patients in regards to scheduling for vaccinations when we know a little bit more about how, we'll receive this at this time, that at this time, because it literally changes hour to hour in our communications with Indian Health Service and the CDC. We have to change our plans. We have to change our structure. I mean, and when Dr. Vark said we're working day and night, I mean, it's emergency calls here, there, and yonder, and that's to be expected. But so expect those, and of course you can call the clinics and ask questions. And if they don't have the answers, then they'll find someone who has the answer. And please remember to wear your mask and wash your hands and stuff. And it's not so much for yourself necessarily as for everybody else. And we'll get through this together.
All right. Well, thank you, gentlemen, for taking the time. I know you guys have been rushed and busy and on the ball, and we appreciate it so much. And we will broadcast this out and keep it circulating far and wide as much as we can. Thank you so much.
Thank you.
Thank you very much. Thank you for having us.
Bye-bye.